and welcome. I'm Nicole Jellinek. I'm the chair of the Rhode Island Coalition for Reproductive Freedom. Our coalition is made up of 24 organizations that work to protect and advance access to reproductive health care, including abortion, through advocacy and legislative action. On behalf of the coalition, I'd like to welcome all of the elected officials who have joined us here today, including Governor McKee, Lieutenant Governor Matos, Secretary of State Amore, General Treasurer Diossa. Unfortunately, Attorney General Norona is not able to be here, but Adi Goldstein from his office is here, and Speaker Shakarchi is not able to be here as well. I'd also like to recognize Mayor Rivera and Mayor Smiley. And my count of senators and representatives, I apologize if you've come in since I started and I didn't catch you. I want to give thanks to Senator Valverde, Senator LaMountain, Senator Zurier, Senator Oyer, Senator Mack, Senator Ujufusa, Senator Gu, Senator Quezada, Senator Acosta, Whip Kazarian, Rep. Knight, Rep. Donovan, Rep. Boylan, Rep. Pagello, Rep. Speakman, Rep. Bennett, and Rep. Cruz. I'm honored to introduce Gretchen Raffa, who will MC our event today. She's the Vice President of Public Policy, Advocacy, and Organizing at Planned Parenthood.
Good afternoon, everyone, and I'd also like to thank Senator DeMario for being here as well. Sorry. Good afternoon. My name is Gretchen Raffa, Vice President of Public Policy, Advocacy, and Organizing with Planned Parenthood Votes Rhode Island, and a proud member of the Rhode Island Coalition for Reproductive Freedom. The abortion rights affirmed by Roe v. Wade 50 years ago was stolen from us last June. While the anniversary marks a reminder of what we've lost, this is also a reminder that Roe was always the floor and not the ceiling. Roe never actually guaranteed that people could get an abortion. Over time, lawmakers steadily pushed harsher abortion restrictions and policies like the Hyde Amendment, putting abortion out of reach for millions, even with Roe in place. Over time, lawmakers steadily keep pushing these policies, and even in our own state, hurdles like distance, money, being able to take time off from work, and other restrictions have stood in the way of people's health, which is why our work must be more intersectional as we move forward. Access to care has never been more vital. 1 in 3 women of reproductive age and more trans and non-binary people no longer have access to abortion in their states because 18 states have banned or severely restricted abortion, and more states are likely to do so this year. We know the communities that are most harmed by abortion bans and restrictions, including Black, Latino, Indigenous, immigrant, people with low income, people living in rural areas, and LGBTQ+ people already face barriers to healthcare and financial opportunity because of this country's legacy of systemic racism and discrimination. The harmful effects of abortion bans stretch far beyond abortion care. It's now harder for people to get life-saving medical care for miscarriages, ectopic pregnancies, and other pregnancy-related complications. And we know that anti-abortion lawmakers and justices will not stop at banning abortion. They're working towards a broader agenda to roll back our rights and our freedom, including limiting our access to affordable birth control, gender-affirming care, to LGBTQ rights, and more. The public support for legal abortion is at a record high. Voters turned out this past election in support of reproductive rights champions, including in Rhode Island, where we elected 60 Planned Parenthood Votes Rhode Island PAC-endorsed candidates, many who stand with us today. And as our General Assembly gets back to work this session, we are so excited to work alongside so many reproductive rights champions in the legislature and the administration, and finally pass the Equality and Abortion Coverage Act, which we know that 2/3 of Rhode Island voters support this bill. Furthermore, 72% of Rhode Islanders think that people with health insurance through Medicaid or the state should receive the same coverage for abortion to those with private insurance. It's time to finally make the legal right to abortion in Rhode Island accessible to all people. The fight for reproductive freedom will take each and every one of us. The path ahead is going to be challenging, y'all. We know it, and it's not going to happen quickly. But it's time to reimagine what is possible for our communities. A vision for a just future that centers those that have been historically left behind will create a more equitable healthcare landscape for all, where people who want an abortion can access one. So we're going to talk about abortion a lot, and we're going to keep reminding everyone that abortion is essential healthcare. Abortion is normal, and abortion is a human right. Because the shame, the stigma, and policies that restrict people from accessing care is dangerous. And we will continue to learn from the past by no longer isolating conversations about abortion from broader dialogues about reproductive and maternal health care. Because we cannot talk about the right to abortion without also talking about the right to parent and parent our children in safe and healthy communities. We must recognize the intersecting issues that impact people's ability to have full bodily autonomy and agency over their lives. And together we are fighting for a world where everyone's individual personal decision about their pregnancy is valued and respected. Today and every day, Planned Parenthood will continue to fight to ensure that abortion remains safe and legal in this country, because we believe deeply in the right of no matter who you are, where you live, what you earn, to make their own personal decisions about their lives, their bodies, their families, without political interference. It is my great honor and pleasure to turn it over to our Governor, Dan McKee, who we would like to thank publicly. Everyone give the Governor a round of applause for prioritizing abortion access in the state budget. Thank you, Governor.
Thank you, and thank you all for being here. Based on the number of reps and senators here, I think you almost got the vote. So that's good. So good afternoon, and I want to thank the women and the men who have championed this issue long before today. And I've said this publicly, since the Supreme Court's decision last year and turned their backs on issues that had been resolved long ago, and many of them confirmed that during their confirmation that they said that was confirmed long ago, and then they changed their mind. This was not representing the people in the state of Rhode Island or the people in the country, and in particular the women that those rights have been taken from. So we've protected women who travel to Rhode Island for safe abortion, health care, and we protected the providers who administer them when I signed an executive order shortly after the Supreme Court's decision last year. Last week I submitted in our 24 Rhode Island Ready budget to the General Assembly, just as I committed to during the summer months. The budget includes proposals that provide insurance coverage for abortion-related services for state employees and individuals on Medicaid.
Yes.
These are important health services for groups who currently can't access them now. And as you know, the three priorities that I have in the 2030 plan is upping our levels of education, increasing our incomes, and making the state healthier. And this particular piece in our budget does just that. It helps make Rhode Island healthier. Let me just close by saying this. You've heard me say in my State of the State that Rhode Island is ready. We're ready to raise incomes, as I said, ready to raise student outcomes in our schools, and ready to make our state healthier. Let me add one more item to the list. Rhode Island is ready to pass the EACA. So pass the bill, get it to my desk, and I'll sign that bill and provide a couple pens to those who are leading the charge. Thank you so much.
Thank you, Governor. I'd also like to thank Senator Lawson, Miller, Representative Cormier, I was messing the name up, sorry, Corbian. Representative Casimira, Representative Kislak, Representative Carson, Representative Spears, and I'd like to now turn it over to our Lieutenant Governor, Sabina Matos.
Good afternoon. Thank you so much for all the work that you have been doing to get us to this point. I want to once again thank the governor for including the ACA in your budget this year. We are so appreciative and grateful that you did that. Thank you so much. I would like to also thank the legislators that are here that are making the hard work to introduce the legislation and making sure that we have that on our state law. And I can see Kazarian back there and the others. Thank you so much to the leadership of the House and the Senate for making this a priority. I just also would like to share with all of you that I worked for the state of Rhode Island before being Lieutenant Governor. I was in the Office of Diversity. As an employee of the state who pays into the state health care, I didn't qualify to receive the service of abortion if I needed them. And that is not right. That's why it's so important that we're here today to send a message clear, loud and clear, that everyone deserves to be fully covered by the health insurance and cover every service that is recommended by their doctors. No one should be being part of a healthcare system that doesn't cover every medical need that you have. So thank you for that. When I arrived to this country, I came to a country which I thought I have all my rights were secure, right? And then we saw what happened with the Supreme Court, and that opens the door that we don't know what else can come after. So that gives me a lot of pause and a lot of concern, but I refuse to despair. And also, as a mother, I had the challenge of trying to figure out how am I going to explain my daughter that right now she's going to have less rights than my son, and that is not right. But again, I refuse to despair, and I want to make sure that we continue to fight. Instead, I want to choose hope. I want to choose hope because I know that with all of us working together, we're going to make sure that we're going to create a better future for our kids. And a future in which my daughter always is going to have the same healthcare right as my son, and there's not going to be a division between them. So thank you so much for the work that you're doing.
Thank you, Lieutenant Governor. I'd also like to acknowledge the House Majority Leader, Chris Blazajewski. Thank you. We're going to turn it over to our Secretary of State. Thank you.
Good afternoon, and thank you for being here. The T-shirts say abortion is health care. So that's a very simple message. And I spent the entire summer with the governor, so I know that wherever he went, he said that. And he made a promise to include this in the budget to cover the over 86,000 people that are not covered currently. And that's a promise kept because abortion is health care. I was a very proud sponsor, a co-sponsor of the Reproductive Privacy Act. And I was proud to vote for that. But it was incomplete. The EACA completes that act. And it's important at a time it's really important at a time when many states are using the Dobbs decision and what would have been the anniversary of Roe v. Wade to restrict access, that Rhode Island moves in the opposite direction. And the other thing I've been doing for over a year is talking about civic engagement. And this coalition and many, many other advocates have demonstrated what civic engagement is. You have pounded doors, you have talked to legislators, you have talked to policymakers, you have pushed the issue. That is what it looks like. That is what it looks like. I want to thank as well Senator Valverde and Whip Kazarian for sponsoring the bill. I want to acknowledge Rep. Jello, who has been a steadfast advocate for reproductive rights her entire legislative career. So let's get this done. As the governor said, let's get this done. Thank you very much.
Thank you. I'd now like to turn it over to our General Treasurer, James Diossa.
Thank you. Thank you. Good afternoon. Are you fired up?
Yes.
I'm fired up. But I really want to give a big thank you to our governor, because he really kept the promise of including this in this budget. So let's give him a big round of applause. I'm fired up because the health care of millions of women is at stake. On Sunday, we should have been celebrating the 50th anniversary of Roe v. Wade, but thanks to a Republican supermajority of the Supreme Court, American women today have less freedoms than their mothers. This decision has impacted everyone, but it has been the hardest on people who already face barriers to health care, especially low-income women. Barriers to reproductive health also pose an economic impact when women are forced into pregnancy and motherhood against their will, especially in communities of color. When women have the freedom to make family planning decisions, their labor force participation and earning potential increases. Overturning Roe is just the beginning of Republicans. For years, they have been working to enact laws to chip away at this fundamental right and access to contraception and IVF. Draconian laws have already been put in place in states like Texas, Oklahoma, and more states are following suit. But we won't let that happen here in Rhode Island. We must pass the Equality in Abortion Coverage Act to eliminate all bans on abortion coverage in Rhode Island. Today, state law prohibits nearly 1 in 3 Rhode Islanders, people enrolled in Medicaid and state employees, from using their health care insurance to cover abortion. The Equality in Abortion Coverage Act will ensure that all pregnant people in the Ocean State can make their own health care decisions in consultation with their doctors and loved ones. We refuse to let an extreme political agenda control the people's bodies and lives and interfere in their personal decisions. No matter where a person lives, what they look like, or what they do, everyone should have the freedom to decide what is best for themselves and their families, including when it comes to reproductive health. The fact that Republicans have refused to invest in child care and public education, paid family leave, medical leave, maternal health, or vote for simple common sense gun violence reform shows that this is all about control and politics, not human lives. Enforced pregnancies without essential care and economic support is a disaster for working families. Thank you to everyone here for fighting for reproductive rights, from House Majority Whip Kathy Kazarian to Senator Bridget Valverde and the Rhode Island Coalition for Reproductive Freedom. Let's keep fighting until this becomes law. Thank you, everyone. Thank you.
Thank you. And we are going to turn it over next to a member of our Rhode Island Coalition for Reproductive Freedom, Reverend Effie McEvoy.
Thank you so much. Yeah, thank you.
Good afternoon, everybody. I am the Reverend Effie McEvoy, pastor of Shepherd of the Valley United Methodist Church in Pope, also known as Situate, Rhode Island. I am also one of the co-chairs of RIUMA, Rhode Island United Methodist Association, #Heart for Social Justice. So I'm wearing actually 3 hats too, because I was called by the Council of Churches to see if I would be willing to render the response on behalf of clergy. I am here. And when I was asked, I said yes. First I asked when, then I said yes. I am a Black, queer woman who is the descendant of the enslaved. Let me repeat that. I'm a Black, queer woman who is the descendant of slaves. And what that means is that I know what it is to be oppressed. I know what injustice looks like, and I know how systemic racism has embedded itself into the realm of American society. Historically, reproductive rights for women or abortion care was rooted in white supremacy. It was rooted in racism. There was a fear that the free blacks would overtake the numbers of white people, and so laws were passed so abortion would be made illegal so that white women would be forced to bear babies and outnumber the babies that the black folk birthed. Read a history book. I know because we're not in Florida, we can do that. So anti-abortion policy is racist. It's sexist. It's classist. And it's ableist. It moves into the intersections that affect all of us, where we live, and who we associate with. It's a thing that breeds in the lives and the minds of folk who harbor hate for the other. We can dress it up however we want to dress it up, but it's about control and it's about hate. And when we tell people they can't do something with their body that they have talked about with their spouse or their partner or their doctor or themselves and their God, it's about control. So, we clergy here, we say that it's not our business what a woman chooses to do with her body. That bodily autonomy is a right. I was fearful that you took my whole speech on your introduction. But I'm going to close with this. That we have all been entrusted with certain inalienable rights, right? To life, to liberty, and to the pursuit of happiness. If we aren't allowed to have health care that affects our bodily choices, our bodily autonomy, and gives us the freedom to do the work that we need to do in this society, then we aren't living into those rights to the pursuit of happiness, those rights to the pursuit of liberty, those rights to the pursuit of a healthy life. Abortion is health care, period. The legislature for seeing that and for working to make sure that all Rhode Islanders have access to this important health care. Because it's y'all's duty too, because you've been elected to take care of all of us, not just some of us. We vote, and we're pleased that you listen. So thank you.
Thank you. I'm now going to call up House Majority Whip Katie Kazarian, the House sponsor of the EACA.
Thank you, everyone. It's very hard to follow the Reverend, but I'm going to try. As we all know, this week marks the 50th anniversary of Roe v. Wade. 50 years ago, in 1973, our country empowered women to make our own health care decisions. But now, 50 years after Roe, much has changed. I am absolutely gutted to acknowledge that I belong to a generation of women who have fewer reproductive rights than our mothers did. While I am proud to stand before you all today and say that Rhode Island passed legislation to protect abortion access in 2018, I must also acknowledge, however, that coverage for abortion in Rhode Island is not equal. Abortion is health care. Reproductive freedom for all means equal access for all. By passing the Equality in Abortion Coverage Act, Rhode Island will no longer allow archaic and discriminatory practices to prevent access to essential healthcare procedures in our state. Oh, thank you. I want to thank the coalition for putting this together today. I want to thank Governor Dan McKee. I want to thank the Senate sponsors, including my co-partner, Senator Valverde. I also want to thank my 42 co-sponsors who are championing this legislation with me, but I also want to give a special shout out to somebody who has been championing this issue for decades, She has paved the way for all of us. That's my colleague, Representative Nicole Jellinek. Last of all, I want to thank all of you for showing up today and for helping us champion this through. Together, we will do this. Thank you.
Thank you. And next we're going to hear from our Senate sponsor, who's been at this for years, and we're going to get it done this year.
Thank you all for being here today. I would really like to thank the governor for including the EACA in his budget this year. I'd also like to thank all of my colleagues in both the House and Senate who have co-sponsored this legislation and are championing its passage. I'd also like to thank the advocates and especially the providers that we have here today who provide abortions to Rhode Island. Thank you. So when I look around at this crowd, I'm reminded of the day in January 2020 when Representative Kassar and I were standing right here on the day when we first announced the introduction of the Equality and Abortion Coverage Act. There was a considerably smaller crowd that day because we had just 6 or 7 months earlier codified Roe in our state law by passing the Reproductive Privacy Act, and all seemed pretty well and good for most Rhode Islanders. But our work was not done. Securing the right to abortion for everyone in Rhode Island was absolutely critical, but we left so many Rhode Islanders behind. We all know that if our health insurance doesn't cover something, it is much harder to get the care that we need. And right now, Rhode Islanders who rely on Medicaid or a state employee health plan are left to cover the full cost of abortion or go without it. And that's not because it's a cost-efficient policy or people on those plans don't need abortions. It's because of the same thing that drives those who are pushing and enacting abortion restrictions and bans in states across this country. It's about controlling people, mostly women, mostly poor women, women of color, immigrants, people with disabilities, people who have not enjoyed power and privilege in this country. It is unacceptable, it is harmful, it is discriminatory. And so we say enough. We can't control what happens in other states, unfortunately, but we can change things here in Rhode Island. We must change things here in Rhode Island. We must pass the Equality and Abortion Coverage Act this year. This week marks the 50th anniversary of Roe, but it is year one of the post-Dobbs world. A year in which anti-choice forces feel emboldened to push harder than ever for more restrictions on reproductive care, including a nationwide abortion ban that would wipe out even the progress we've made here in Rhode Island. We must all remain vigilant in this truly horrifying time we live in when it comes to reproductive freedom and justice in the United States. While other states continue to move their healthcare systems backward, Rhode Island must move ours forward. So for everyone here who is both a legislator, an advocate, a provider, please promise me that you will continue to show up in this building as often as you can until we pass the until we pass the Equality and Abortion Coverage Act and send it to the governor's desk for his signature. I know that we can get this done if we all work together. So thank you again for being here.
Thank you. Thank you so much, Senator Valverde, for leading the effort in the Senate. I also want to say a special thank you to Representative McKee, who's also here, Senator Loria, and I'm sure I'm probably missing more folks that keep coming up. I am now going to turn it over to our House Majority Leader, Chris Blazajewski. I said your name really weird. I don't know what that was. That was a weird intro.
Thank you very much. Thank you, Gretchen. And I really just want to start by thanking my House colleagues because to get this over the finish line, we're going to need each and every one of their support. We have here today Rep. Carson, Rep. Donovan, Rep. Cruz, Rep. Boylan, Rep. Edie Agello, who has been a champion on these issues for so long. Thank you, Edie. Chair Bennett, Rep. Morales, Rep. Knight, Rep. Speakman, Rep. Sanchez, Rep. Spears, Rep. Corcoran, Rep. Kislak, Rep. McGaw, Rep. Alzate, and Rep. Felix have been so helpful in getting this done, and that is a list of about 18 names. And the last one on that list that I haven't mentioned managed to get 43 names on this bill in the House in 3 hours. Whip Catherine Kazarian, where is she? If you've ever tried to get names on a bill, to do all of that in such a short period of time is a testament to your work. Thank you very much, Whip Kazarian. You know, to be here on the 50th anniversary of Roe brings a lot of mixed feelings. You know, I'm still angry at the United States Supreme Court for what they did, for overturning a decision that for 49 years protected reproductive rights. But I'm still hopeful. And I look around this room and I know that 50 years ago people were doing this same fight, and today we're here today fighting again, fighting for reproductive freedom in Rhode Island and across the country. And I just want to say that, you know, to have this legislation go forward is going to require so much effort from the advocates. And in particular, I want to thank for the Rhode Island Coalition for Reproductive Freedom, Nicole Jellinek. Nicole, thank you so much for your work. And of course, our friend from Connecticut, from the Planned Parenthood of Southern New England, Gretchen Raffa. Big round of applause for Gretchen. Thank you for all your work. An honorary Rhode Islander. And of course, I want to thank Governor McKee, Governor Matos, Secretary Amore, who's been a champion on these issues in the chamber with us for many years, and of course, Treasurer Diossa. And last but not least, I just want to thank the healthcare workers from Planned Parenthood and healthcare workers all across the state. Thank you for your work to keep Rhode Island healthy and safe. Thank you very much. Thank you, Gretchen. Thank you all. We'll work to get this done.
I also want to acknowledge and thank Senator Murray, Senator Loria, Rep. Morales. Am I missing anyone else? I'm sure I'm missing someone else. Rep. Tansy, sorry. Thank you. And speaking of providers, I would like to give the mic over to Dr. Beth Cronin from the Rhode Island section of ACOG, and I am really honored and privileged to be working alongside Dr. Cronin.
Thank you, everyone, and I'm really glad to be here this afternoon. While I wish I was here today celebrating the 50th anniversary of Roe with a different lens, knowing that abortion rights were taken away from us last June strengthens my desire to continue our fight. We need to fight for a more equitable future for each and every one of my patients and all Rhode Islanders. My name is Beth Cronin, and I'm here today as the chair of the Rhode Island section of the American College of Obstetrics and Gynecology, representing OBGYNs across our state. ACOG strongly condemns the U.S. Supreme Court's decision in the case of Dobbs v. Jackson, a direct attack on the patient-physician relationship in the practice of medicine. Pregnancy can and often is a high-risk time in a person's life, particularly for those with medically complex conditions, and our country's maternal mortality rates are already unacceptably high. This decision is taking us backwards. The harm the U.S. Supreme Court's decision is being experienced most acutely in the communities that are already systematically marginalized, exacerbating unacceptable inequities in our healthcare system. 7 months have passed since this decision, and we are clearly seeing this impact around the country. Patients are struggling to access abortion care. Physicians are being forced to make decisions they should never have to make. When is the pregnant person's life at risk enough that an abortion might be allowed? Could I lose my license doing this life-saving procedure? How can I get my patient the care they need urgently? We are fortunate living here in Rhode Island, as abortion was codified into state law with the Reproductive Privacy Act. So this essential healthcare procedure is legal, but not everyone can actually access the care they need. ACOG affirms that public and private insurance coverage of abortion care should be considered part of essential healthcare benefits and not singled out for exclusion or additional administrative or financial burdens. I applaud Governor McKee for drawing attention to the maternal health crisis in our state, proclaiming yesterday, January 23rd, as the Rhode Island Maternal Health Awareness Day, as well as taking the critical step of including the funding for the EACA into his proposed budget. However, there is still so much more work to be done. As many have said, it is crucial the Rhode Island General Assembly do the work this year to pass the EACA once and for all. We need to ensure that every Rhode Islander has access to the health care that they need. The cost of an abortion without insurance coverage is significant. The average cost of a first trimester abortion, whether surgical or medical, is somewhere around $650. Second trimester procedures being significantly more. In addition, patients often must pay out of pocket for additional non-medical costs, transportation, childcare, time out of work. These costs are prohibitive for the majority of low-income individuals, most of whom are my patients. Whenever I counsel a patient with an unplanned pregnancy on options for care, and she tells me she wants to proceed with an abortion, my thought then immediately has to become, what type of insurance does she have? How much will this cost her? What can I do to help her facilitate getting the care she needs? It seems completely unfair that my patient who works 3 jobs to feed her family and relies on Rhode Island Medicaid for her health care would have to decide whether or not to feed her children or skip paying for heat this month in order to access the health care procedures she needs. I believe in a world where abortion is affordable and available for everyone who seeks care. I'm here today encouraging everyone to continue the fight for abortion justice to ensure there is care for all of us, whoever we are, wherever we live, whatever type of insurance coverage we have. Racism is a women's health crisis. The COVID-19 pandemic compounded this crisis and highlighted the consequences of persistent inequities and disparate outcomes in healthcare. ACOG, along with more than 20 organizations, released a document outlining the collective and sustained intentional actions that we need to take to eliminate racism and racial inequities that lead to disparate health outcomes. The Hyde Amendment, which is discriminatory and has disproportionate negative impacts on people of color, perpetuates the structural racism. You can and must play a role in helping us to address this public health crisis by committing to the EACA to promote equity across our state. On behalf of the American College of OBGYNs, strongly urge all of the General Assembly to finally pass this bill this year. Please assert that abortion care is an integral component of health care for everyone and it should be covered equally for each person. Thank you.
Thank you, Dr. Cohen. And lastly, but definitely not least, is the voice and the power of young folks in Rhode Island. I'm going to turn it over to Maria Zhao for Planned Parenthood Votes Rhode Island.
Thank you everyone for being here. My name is Maria Zhao and I stand here today thinking about how what would have been the 50th anniversary of Roe just passed. And yes, it reminds me that our right to abortion as young people in the future was stolen from us in June. But it also reminds me of all the people here today and all the people who rallied in 2019 to pass the Reproductive Privacy Act. At the time, I had just moved to Rhode Island from Ohio, and while I was fighting for the RPA in Rhode Island, back in my home state, they passed a 6-week abortion ban. At the time, one of the strictest in the nation. So I think to myself, what really made the difference between Rhode Island and Ohio at the time? Yes, we live in very different political climates, but what strikes me most is the passion for change in the young people who live here. In college, I meet people who take the time out of their busy schedules to lobby at the State House and learn to write testimony together. I met the innovation of the Gen Z community in Providence, who persevered through COVID, hosting Zoom advocacy nights and social media campaigns. And what stands out to me most is the fierce belief that our future is in our hands and we refuse to settle for the bare minimum. We are the generation that understands the importance of an intersectional approach. We focus on what our communities need, not just the rights. And we turn out. We voted in record numbers in the 2022 election, with Black Gen Z voters voting at nearly 90% for abortion rights and 68% of Latina voters supporting abortion rights. Yes, in Rhode Island, 2019, we protected the right to abortion. But we are the generation who knows the right means nothing without access. Yes. And we will fight for a future of reproductive freedom. That means sex ed that's inclusive to all. That means abortion that's free of stigma and hate. It means abortion that's not just protected, but accessible. And we are making our voices heard, and we're asking you all to help make it happen. Thank you.
Thank you, Maria. I think we're in good hands. So that concludes our very long press conference. I want to thank you on behalf of the Rhode Island Coalition for Reproductive Freedom, and we're happy to answer any questions.